Ayurvedic lifestyle, the key to health. Ahara Vidhi Visheshayatana, part 21. So I was talking about eat only when the previous food is completely digested. जीर्णेन्द्रिय भुंजी. चरक में एक श्लोक आया है, अजीर्णे सायमाशेतु प्रातराशो हि दुष्यते. If the previous day's food is not properly digested, then definitely the breakfast hampers your health. So we have accepted breakfast concept from the Westerners. Initially in Ayurveda or in India, the tradition was to have only 2 times meals, lunch and dinner, that's all. Sayam pratar manushanam ashanam shruti choditam nantara bhojanam kuryat agnihotra samovidi. There is one Dr. Jagannath who is practicing in diabetes, and he is propagating this concept of only 2 meals a day throughout the world, with very good results in particularly diabetes. So if we have only 2 times meals, then that is better option, better for your health in other diseases as well, not only in diabetes. It reduces obesity as well. But what has happened, people started taking heavy breakfast in the morning, following the concept of Western countries. And in Western countries, the lunch is light, it's working lunch or something like that. Maybe a sandwich or something. And the dinner is also very early, before sunset and light. So then they get a chance for the proper digestion of the food, and then they feel very hungry in the morning and they can eat breakfast. What has happened in India, though the breakfast is heavy, the lunch is also heavy, and the dinner is also late and heavy. As a result, there is indigestion, continuous indigestion, and we are keeping on eating without hunger, without proper motion, urination, etc. So I get many cases, some arthritis, rheumatoid arthritis, spondylosis, and diabetes, cancer, etc. Varieties of cases. And when I examine them empty stomach, particularly the tummy, I found that this is very heavy. The stomach is full, even at empty stomach. So I asked them to skip breakfast initially. So if they skip breakfast, then they may feel hungry at brunch. So if they are accustomed to breakfast at 8:30, 9 o'clock in the morning, by 11:30 they may feel hungry, and the abdomen is also light, so they can eat at that. If they don't feel hungry even at that time, but feel hungry at the time of lunch, 12:30, 1 o'clock, that is also fine. But then they should skip breakfast and only go for brunch or lunch. If it so happens that even at that time they don't feel hungry and the stomach is still full, then one has to think of the dinner and skip the dinner or replace it with soups, maybe vegetable soups, maybe moong soup, like that. And then they have proper digestion, they feel hungry, maybe at brunch, maybe at lunch. And this brings relief in the disease, and the symptoms start diminishing. So this is a treatment for any kind of disease. Not only indigestion, but any kind of disease, because indigestion is the root cause of varieties of diseases. So if we try to follow the rule Jirnena Bhunjita, eat only when the previous food is digested, then that works very good. Many people say that they have to take allopathic medicines in the morning, so they are eating or something like that. But this is really not good, it's wrong. They may have the medicines at brunch or lunch if they don't feel hungry at the time of breakfast, but just don't eat without hunger. That is most important. So Try following this rule throughout your life. Namaste.